Hi, my name is Keith Wakeman. I'm the CEO and co-founder of SuperBetter. I'm excited today to share with you some of the insights and data around our learnings in response to the mental health burden of the COVID-19 pandemic. Let me start by introducing SuperBetter. We're a popular app that increases resilience, mental health, and success. Our definition of resilience is the ability to stay strong, motivated, and optimistic, even in the face of change and difficult challenges. We focus on resilience for two reasons. First, resilience is something that can be developed. It's not something we're either born with or without, and we've shown with our proven methodology that we can help individuals achieve higher resilience. Second, the scientific literature shows that higher resilience is associated with success in a variety of areas in life. For example, students with higher resilience are shown to have greater academic success. They get better grades and they graduate at higher levels. Employees with higher resilience do better in the workplace. They're more agile and productive. They're better able to avoid burnout and manage stress. There's a strong relationship between higher resilience and mental health, as well as thriving within a variety of areas of life. SuperBetter was invented by Jane McGonigal, our Chief Science Officer. Jane is a researcher, a world-renowned game designer, and the global thought leader for how we can use the science and the psychology of games to improve real lives. Jane invented SuperBetter out of a personal incident in her own life. If you're curious about the story, I encourage you to watch her fantastic TED Talk. Users experience SuperBetter as a game that's played in real life. So we're not a video game, but we borrow from the mindset of video games as well as the familiar language. And what happens when we play video games? Well, we're focused on a goal. We're determined. We're courageous and creative. We're willing to fail. And when we fail, we get up and we try again, often with a different strategy. We recruit allies for support. All of these characteristics that we use in gameplay can be very powerful to achieve goals and tackle challenges in the real world. Connecting to this mindset of video game also allows us to draw from the popularity of the global phenomenon of video games, now played by 2.7 billion people around the world. That's more than 1 of 3 people globally that regularly play video games. This summer, we're crossing the milestone that 1 million people have played SuperBetter so far. All of the growth in SuperBetter has been organic and grassroots. We haven't invested in any paid advertising to attract these users. Media regards SuperBetter as a leader. We're regularly featured on lists of best apps for mental health, depression, anxiety, happiness, mental well-being, along with other respected and leading mental health and well-being apps like Calm and Headspace. SuperBetter is among that smaller percent of mental health and well-being apps that are backed by published randomized controlled and clinical trials. In this randomized controlled trial at the University of Pennsylvania, players who played SuperBetter for 30 days significantly reduced their symptoms of anxiety and depression. Now, back in March, when the World Health Organization announced the global pandemic, we knew right away that it was going to create a significant mental health burden, and that the pandemic and the repercussions of the pandemic would create emotional trauma globally at an unprecedented level. We made a decision right away among the SuperBetter team that we would shift our focus and do what we could in the near term to help alleviate the mental health burden while we worked on partnerships to have greater impact over time. Since then, the United Nations has warned of a global mental health crisis during and after the pandemic. So what did we do? Well, right away, we reached out to our community, the SuperBetter community, and we reminded them that SuperBetter is out there as a resource and a friend that can help them address and navigate the mental health challenges related to the pandemic. And in the early days, that was largely talked about in the marketplace as feelings of anxiety. Our community, in turn, shared that and referred SuperBetter to people that they knew. And we saw an immediate surge in app downloads and global app sessions during those first couple of weeks. The team went to work on creating new power packs, which are content found within SuperBetter. And we created 2 new power packs. We called it the Pandemic Edition for SuperBetter, really designed specifically to help people navigate the challenges of the pandemic. One of the power packs was called the Stay-at-Home Scavenger Hunt, and it worked to increase social connection while we're physically distancing. It also activated powerful positive emotions like curiosity. The second power pack was called Stay Strong in a Pandemic. This one, we went out to our community because the pandemic was new to all of us, and we asked, what are you feeling? What are you seeing? What do you anticipate your greatest challenges are and are going to be during this time? And what's working for you right now? And we use that as input to guide the development of an evidence-based power pack focused on helping players holistically to build their resilience in 4 areas: their mental resilience, emotional, social, and physical resilience. Both of the power packs have been very well received. What I'm going to share with you now is some of the data and some of the insights that we're gleaning from our lens in terms of our response to the pandemic and how the market has reacted to it. So a few things. First, demand for our digital tool has increased. Our downloads in the second quarter increased by 12% over the first quarter. Secondly, we're seeing more media attention talking about the mental health challenges and burden of especially related to COVID-19. And so as the media interest has increased, the number of stories that are featuring SuperBetter has increased. So we're seeing year to date a 3 times increase versus a year ago in the number of meaningful media stories that include SuperBetter. And quantitatively, that leads us, we have a little over 50 meaningful stories so far this year. We're also seeing more interest in virtual community support. So we offer a virtual SuperBetter official community group. The number of new members that join each week since the pandemic has started has doubled versus pre-pandemic levels. And the last insight is around organizations who are increasingly looking to digital solutions to support the populations that they serve. So many organizations have set up COVID-19 resource websites for the people they serve. Others have added new resources to existing websites related to counseling centers and mental health or other areas. What we've seen is a significant increase in the number of organizations that are referring SuperBetter, and these include colleges and universities, K through 12 schools who are promoting SuperBetter both for mental health as well as social emotional learning as we move to a digital time, medical centers and counseling centers, local governments, as well as nonprofits, especially those focused on mental health and or youth. And so those are some of the data and statistics. And then the last area I want to close on is, where do we go from here at SuperBetter? How has the pandemic shifted and changed and influenced our areas of future focus? So even before the pandemic, we were very concerned about the alarming declines in mental health among young adults and youth. These trends started 8 years ago. The chart on the screen shows the percentage of major depressive episodes within each population group. And you can see there that starting in about 2012, there's been a significant increase in depressive episodes among 12 to 17-year-olds and 18 to 25-year-olds. I could show similar charts showing increasing trends around psychological distress, anxiety, and suicidal ideation. Our concern is that the mental health burden associated with the pandemic, while the burden is going to be put upon everyone, that our young adults and our youth are at increased risk to having that burden increase their mental health challenges. And the concern is that these alarming increases are going to continue, or worst case, even accelerate. And so SuperBetter wants to be part of that solution, and we're talking to and are interested in talking to organizations about how we can bring our proven methodology to more youth and more young adults in the areas that they live and learn and work, in order to help increase their resilience and mental health and success. Thank you for letting me share some of our learnings and our insights. My contact information is here. Feel free to reach out with any questions or if you'd like to connect. And as we say in the world of SuperBetter, you are surrounded by potential allies. Thank you.